My name is Jeffrey Davis, and this is Radio Entrepreneurs. I'm here with Peter Morrison in the Money Matters Radio Network studio. Peter, you want to introduce our next entrepreneur?
Sure, Jeff. Our next entrepreneur is Ed Levitan of Visions Healthcare. He is the founder. Can you tell us something about Visions Healthcare, Ed?
Absolutely. Thank you for having me here. So Visions Healthcare is an integrative practice that does not only primary care, but also does functional medicine. We have 2 locations in Wellesley and Dedham, and we really look at getting to the root cause of disease and or any conditions.
So, explain to me, I mean, when I go to my doctor, he prescribes, medicine. Do you do things other than prescribe medicine?
Well, we definitely prescribe medicine. So let's start there.
Okay.
On top of that, we look for other causes. For example, do you have a food allergy? Do you have a vitamin mineral deficiency? Is there something in your lifestyle diet that we can alter? For a first visit, you can expect to spend an hour with us, really evaluating your health. And then follow-ups are half an hour, which is a very different model than conventional medicine.
So tell us about this model. How did you get there?
So we know that medicine doesn't work very well right now in terms of patients aren't satisfied necessarily with seeing physicians for 5-10 minutes. We know that physicians aren't satisfied for seeing patients 5-10 minutes. So we're really looking to broaden the scope of what we do. So right now, the tools of conventional medicine allow us to basically listen to the patient and write a prescription. We've added the functional medicine tool on top of that, which looks at root cause of disease. For example, when you talk about, there are people that have in conventional medicine, there are people that have celiac disease and then people that don't have celiac disease. And that's kind of the only thing. It's an on and off switch. In functional medicine, there's something called gluten sensitivity, which now even last week the New York Times wrote up about that, and it's becoming very trendy, I would say, but it's a very popular thing right now. We have, in most of these disease, we have different levels, and we try to get people before they actually get the disease.
Interesting. But so you're saying the new classification is, because it's a little bit more sensitive, is gluten sensitivity, because it's not an on or off switch anymore. There's like a gradient.
From American Medical Association, it's still an on or off switch.
Right.
But from the newest and latest science, it absolutely is a gradient, and we're finding that in many diseases, and we find that we can actually alter the course of the disease using functional medicine tools.
So how did you become an entrepreneur? That's not how you really sort of started out.
Yeah, so that's an interesting. My parents and my brother are serial entrepreneurs. That's what they do and that's what they want to do. And why I chose to go into medicine was to be not like them. And obviously that altered. The difference in my mind is a lot of people go into business to make money. And I'm in business, we have to make money. We have to keep our doors open. We have to feed everybody. And the first thing we do is take care of our patients. A close second is to make money. And that's a little bit of a different point of view.
So do you find the experience a lot different?
I do, because we really look, what do we do to take care of patients first? How do we make sure not only our patients, but our employees, our physicians, we're really looking to create a model that works for our patients, works for our physicians, and is financially viable. And in the 20 years, we're actually we're looking to be the face of healthcare. So everything has to come together, not only the money, but the care and the quality.
So it's very different for you.
Very different for me.
How's your practice grown?
So I started out by myself with 2 employees in 3,900 square feet. I thought I'd be around for couple of years, add maybe a physician or so, and grow slowly. Today, we actually, 3 weeks ago, we opened up a new 21,000 square foot facility in Dedham. We have 13 physicians, 60 plus employees, and we started with 300 patients a month. We now have over 2,000 patients a month.
Wow. Do you have any partners in the business?
Just me right now. Eventually, we'll look to broaden that, but because the business has to change so swiftly in terms of with all the reforms and everything else, we need to be able to move swiftly to change with them.
Do you have a board of directors?
We have board of advisors, yeah. That we have a board that meets pretty much twice a week. Myself, the quality director, and the business director, and runs the general business, yeah.
Are the people who come to see you all insured, or is this a non-insured practice?
Yeah, so that's a great question. Most practitioners of functional medicine are cash only. If you go to New York, if you go anywhere else, pretty much it's cash only. We work as much as we possibly can in the insurance model. So whatever can be covered by insurance is covered by insurance. So things like nutrition, we have 2 nutritionists on board. We have chiropractor. We do allergy testing and treatment. All that's covered. Things like acupuncture are mostly not covered because insurance isn't able to cover it. For those insurances that do, we'll take those. Massage therapy is not covered. So anything that does, and we do.
So you have a lot of non-physician employees beyond the normal staff that would be required.
Absolutely. We actually divide health into 5 different areas, and that's a really important distinction of what we do. We divide health into the physical body, the biochemistry, emotional, psychological, energetic, and spiritual, a sense of purpose in life. And we feel that they're all equal. And anybody coming in with a problem really needs to address 2 or 3 different areas to really make a difference for themselves. I can give a great example. It's the simplest example. I wish everything was so simple. So if a person comes in overweight, I can give them the best biochemical treatment in the world. I can give them the best diet, drugs, supplements, herbs, whatever. If they're emotionally eating, none of that's going to work. So I have to address the emotions behind the food, or we have people to address the emotions behind the food. And that's what we really strive to do, is provide experts and the best people.
Wasn't that the most chronic issue with overeating? It's an emotional response?
That's one of the issues, but it's also education.
Right,
People
education, addiction to sugars.
Yes, all those.
Body dependencies on sugars.
Yep, and body image, and
right.
You call it, and there's also biochemical issues. When you're overweight, you have your adipose tissues creates chemicals that keep you overweight. So we have to address that too. So it's everything. If a person, when you talk about spiritual, when we talk about spiritual, we talk about sense of purpose in life. So if a person doesn't have a sense of purpose in life, why should they go out and exercise? Why should they eat well? So we have to really address all those issues. If the person is overweight but they can't walk because they have an old injury and they haven't addressed it from a physical point of view, we have to address that. So we really do try to provide the best people for all those different areas to make the most profound difference.
You know, you come from a long line of entrepreneurs. Where do you want this practice to go, and how do you see yourself getting there?
So what we always started out with is long-term vision. We're looking to, within about a 5-year period, we're looking to acquire 200 plus acres within 30 minutes of Boston. On that 200 plus acres, we'll have an organic farm, a school that kids learn on the land in addition to the classroom, a kitchen where people learn how to cook and eat, and the best practitioners teaching the next generation, from acupuncturists to MDs, DOs, etc. At some point, we'll have a residential center where people with chronic illness like cancer, chronic fatigue syndrome, fibromyalgia can get intense therapies with us. From that main center, we're looking to have 50 plus satellite offices within the New England area, where people learn on the main center, go out into the community, bring that to the community, come back, learn some more, and go out into the community. Again, what that creates for us, it's a nice vision of what we're up to, hence the word visions, and where our name comes from. But we're really looking to be the face of healthcare. We're really looking to create that model that does work for the patient, does work for the provider, and is financially viable. So that's what we're long-term goal of what we're up to.
Do you find doing a business like yours is unique in Massachusetts at all?
It's actually unique in the entire United States.
Does practice opening up the business in Massachusetts make it easier here, or is it harder here versus other states?
Both. So, there's a couple of places there to talk about. One is Massachusetts, from a medical point of view. On one hand, the way we practice medicine in Massachusetts is pretty conservative. In other words, it's pretty by the book. And if you're not by the book, you have to be very careful, and you have to make sure you dot all the I's and cross all the T's, and etc. On the other hand, Massachusetts is very progressive. The Affordable Care Act, the Obamacare, is modeled on us, and we also have now the ACO model, the Accountability Care Organization, that is the next step, that looks at keeping people well and paying physicians to keep people well. And I think our model is actually primed to get that, stay there.
Ed, very interesting business model. If somebody wants to know more about your business, how would they contact you?
Our website, visionshealthcare.com, and our number is 781-431-1333.
Great. This is Jeffrey Davis with Peter Morrison. We've been speaking with Ed Levitan of Visions Healthcare. Ed, we hope you come back again as you continue to grow. And we hope you join our Facebook